market sensitive. That'll be part of the overall federal regulation that we are adopting. The House will pass it probably in October.
Very good.
Yeah. Yes. It's working? It's not over, Peter.
It's testing, okay.
Very good.
Has anyone in your office or in the budget office looked at if we adopted for reimbursement of hospitals and doctors the Massachusetts schedule for Medicare, how many billions of dollars we'd save? If you are in Florida and you need a colonoscopy, it's $4,200. In Massachusetts, it's $1,200. I haven't seen any doctors from here leave and go to Florida. There must be something, rather disease there. So that's part of it. The other part of it is, has anyone looked at using, removing the cap on salaries in FICA as a way of paying for this?
Yes, let me take the last question.
That comes from wages.
The last question, well, there is no FICA cap on Medicare. There is on Social Security. The Medicare is now not capped. It was originally. The Social Security cap, FICA, for those who weren't, that's Social Security taxation. If you know, it's on the first, 90-some-odd thousand of your income. As we reach the problem, Social Security is now in good fiscal shape, but it will begin to start to have a problem in late 2030. It's in 2030. There will be a need to do some adjustments then, and one very possible adjustment will be an increase in the cap on the wages. As to the fee setting, I want to differentiate. There is some fee setting mechanism in here. Part of it is, it goes back to what the doctor mentioned before. There is an effort in this bill to increase the attractiveness of being a primary care physician. There is a problem with compensation with primary care physicians, and there are efforts in there to incentivize more people to be primary care physicians. As to hospitals, we have a special issue here in Massachusetts, by the way. Look, healthcare is important in Massachusetts, unlike other places, in two ways. One, as a service people get. Two, as an industry. Our hospital in St. Luke's and Charlton and St. Anne's are big employers, as is Morton and Taunton. In the hospitals in general, particularly in the greater Boston area, they are very important for the state's balance of payments. You have a degree of first-rate medical care there that people come from all over the world to get and spend money in Massachusetts. I mean, one of our products is first-rate healthcare. We also have a burgeoning medical products industry, which is a high-tech industry less likely to be outsourced. In fact, the Massachusetts Congressional Delegation was a little worried that some of the proposals to cut costs were going to impinge too much on our hospitals, in particular our teaching hospitals, which are very important here. So I'm a little bit cautious about that. You pull the mic down a little bit.
My name is Violet Carey, and I'm 89 years old. Wow. There are approximately 300 million people in this country, approximately 250 of which have health insurance. If we include 50 million more people into the system without increasing the amount of doctors, nurses, and facility to treat these patients, how am I, or anybody worse than me, for that matter, going to be able to get a timely appointment with the doctor once you add in all these new patients? Could you please explain?
Yes. I guess I know some of those people don't have health care, fishermen in New Bedford, and I'm not comfortable saying to them, tough, you don't have health care and other people do, and I don't want to make room for you. In fact, in the short term, you could do that through, well, for instance, the way we've been doing nursing. Let me give you an example. We have a terrible shortage of nurses here. That's a great mistake. We have dealt with it in part by importing nurses. That's a short-term approach. I think it's one of the areas where we need to be spending, frankly, a little bit more money. I was very pleased when the President announced a great increase in funding for community colleges. I had a conversation with Jack Sprague, the President of Bristol Community College, about nursing, and he said he wishes, we have a need for nurses around here. We have young people who can be nurses. And if people become nurses, by the way, we don't have to worry about outsourcing. You can't stick a needle in somebody from Mumbai. If somebody becomes a nurse, they're going to be working here and the job will stay here. But the Bristol Community College has too few slots. So increased funding for this is important. What I'm saying is in the short term, it may be through immigration. In the intermediate term, I believe we can increase the supply of medical practitioners. And there are some people, we heard a doctor talk about it, some people have left the medical profession because of conditions. I believe that the right kind of approach can draw some of them back in. So I do agree we have to increase supply, but I'm not comfortable saying, well, look, some of us have it, and a few, 1/5 if you don't, or 1/6 if you don't, and you get frozen out. But so I think in the short term there may be some immigration issues there with people coming here, and in the not too long term, I believe we can increase the supply. Yes, sir. Yes, sir.
Congressman Frank, thank you very much for coming and trying to get some answers to us, to the world, here in Dartmouth. I'm Joe Toomey, and I'm the chairman of the Veterans Advisory Board here in Dartmouth, and I served in Vietnam. And I have quite a few constituents that are worried about their care right now. And they're in a special group that is growing very quickly because we're doing a very good job out in the field in Iraq and in Afghanistan, bringing back more of our boys and girls that are doing a great job, but they have a lot of ailments. You did say that you're looking for other sources of revenue, and I understand the situation because Dartmouth is looking for other sources of revenue as well. But my question is, as we introduce this new health care for everyone in the United States, including the extra 50 million that don't have any care, the rationing of resources is going to be very, very tight. How do we avoid the progress that the VA, Veterans Administration, and the veterans groups have made so far in getting the care that they need and bringing up the level of care that they need, and not jeopardize that and rob Peter to pay Paul in order to introduce this other larger health care program?
Well, first I said the increase will come. By the way, some of these people, let me go back a step. I should have answered this before. When we say people don't have health coverage, that doesn't mean they're not getting health care. Many of them are getting it. They're getting it in hospital emergency rooms in a very inefficient way. So it is not that they're not getting care at all. There are some who get no care at all, but hospital emergency rooms are an expensive and inefficient way to do it. So a better use of resources there. It's not like more people getting care as much as more efficiently. Secondly, and I should have said this first, as far as services concerned, the debt we owe you and other Vietnam vets as well, it has totally registered. This bill, Steve Bouya, who was the chairman of the Veterans Affairs Committee as a Republican in the last Congress and is now the senior Republican on the committee, offered the amendment in committee to make it very clear that nothing in this bill will change the health care of the Veterans Affairs Department at all. It will not be affected. They will continue to get it. By the way, for those who think government health care is a terrible thing, I suppose you stay out of the Veterans Affairs hospitals, which are government-run hospitals, but which have done a very good job of providing health care. So there will be no change whatsoever in the VA. And in fact, one of the things that's happened in the last couple of years has been a substantial increase in the level of health care. The President had an ill-advised proposal to try and cut back. He withdrew it. We're going to go forward, and as you pointed out, medical care has advanced. People are surviving terrible wounds today who would not have survived years ago. So you want to say that's good news. George Orwell, the author, was shot in the neck during the Spanish Civil War, and when he survived, someone said, "Oh, you're lucky, you survived." He said, "Yeah, well, all the people who were never shot in the neck in the first place were even lucky." There's nothing lucky about surviving a terrible wound. It's only a less of a tragedy. But it does put more of a strain on us, and we've also gotten better at understanding the mental stresses. So yes, that will continue to be a very high priority, and there will be a continued increase in the resources, and I don't think it's going to come to that. Veterans will come first and continue to come first, and that's very